America is home to 33 million small businesses, the beating heart of communities across the country.
And proof that the American dream is still alive.
This is a show about those dreamers and doers and the communities they serve.
Their real life stories.
Their struggles and successes.
Their grit, determination, and passion.
And the people who fight
to keep their American dream alive.
I'm Alfredo Ortiz.
I'm Elaine Parker.
And it's time for another episode of Main Street Matters,
America's small business megaphone.
Hi, and welcome to another episode of Main Street Matters, America's small business megaphone. I'm Elaine Parker, the president of the Job Creators Network Foundation.
And I'm Alfredo Ortiz, CEO of Job Creators Network.
Please subscribe to the show at salempodcastnetwork.com or wherever you get your podcasts from. And now it's time for our interview with Dr. Leah Houston. Dr. Houston founded Humanitarian Physicians Empowerment Community, or HPEC for short, a digital identity and credential data wallet for practicing physicians. The HPEC wallet is a decentralized application now available on the App Store that makes the physician primary source of ownership and control of their professional credentialing, data, and can be leveraged to give them control over the greater healthcare ecosystem. Dr. Houston, welcome to Main Street Matters, America's small business megaphone.
Awesome.
Tell us a little bit about HPEC. I'm so curious about the system.
Well, a lot of us find friction and frustration in the healthcare system. You know, I was talking to somebody the other day, they wanted to go see their doctor and they're like, oh, just having to create an appointment is just
Right.
just the thinking about it was just this onerous task. And we as doctors want to be accessible to you. We want you to be able to find us, to access us for appointments and scheduling to be easy. We want people to understand what to expect when they see their doctor, whether it's going to be a 2-hour wait or a 10-minute wait. And they also, we also want people to have transparency around the prices that they're paying and the bills that they're going to be getting paid. And this all has to do with authentic data and having access to authentic, real information about what's happening. And because our world is now digitized, we can streamline the process and automate the process of understanding and accessing the actual encounter with your doctor through accessing data in a streamlined and automated way. And so, I came across the decentralized identity community, having just been in Silicon Valley. And I actually, just was interested in all kinds of different investments. I invested a little bit in cryptocurrency, a bunch of other early technologies, Facebook, Netflix. But a hospital actually stole my identity. And they were actually billing under my name after I left that hospital when I was no longer licensed in that state. And that identity theft also led to fraud against the patients that were told, in their bills that they were seeing me when they actually were seeing somebody else. And
Wow.
That led to a huge legal battle with that health system that I eventually was able to, I wasn't working there, so I was able to prove that. But it led me to kind of remember learning about decentralized identity and realizing that it's not only a solution for identity theft and fraud against patients, but it can streamline and automate the process of, connecting with doctors directly and us, being able to own our professional brand in the digital space. And so that's what led me to create HPEC.
I mean, it's a fascinating concept. I mean, as small business owners, as you know, healthcare costs is one of the leading costs that they have, basically that they have to deal with. And it just keeps going up year over year over year. I think we just saw something that said the premiums are going to go up 30, 40, 50% again next year. So this is just an out of control system. It's been out of control for decades now. Just give us a sense as to how HPEC and this new system kind of addresses some of those, out of control costs. I mean, what are we talking about? Like a small percentage, a big percentage? I mean, just so people understand the importance of what you're doing.
An enormous percentage. So just to put things into perspective, the United States healthcare system, when I started the company, was $3.9 trillion. Today, it's $4.2 trillion. So in a couple of years, we've gone up by hundreds of billions of dollars.
Wow.
And if you think about it, it's the 5th biggest economy in the world. We have the US entire economy. Then we have China. No, we have China first, then the US, Japan, Germany, and then the US healthcare system is bigger than every other country's entire economy. So, when you think about it, also, only 30% of every dollar actually goes towards healthcare. And the rest is administrative burden, unnecessary onerous costs and things like that. And so, decentralized identity is a tool that essentially cuts out the middlemen that are siphoning off value from the pain and suffering of patients, and it gives an opportunity to give that value back to the patients, to reduce costs and to create price transparency around what you're charging. There's certain regulations recently, the No Surprise Billing Act, for example,
Right.
is essentially forcing us to have an understanding over what's being covered by your insurance and what's not, so that patients can make decisions that, aren't going to affect their long-term financial stability. Bankruptcy, the leading cause of bankruptcy, personal bankruptcy in the US, is medical bills. And that's just unreasonable. My care as a doctor, yes, I need to be paid for my services, but there are layers and layers of extra fees added on, facilities fees, kickbacks between health systems and pharmaceutical companies. I got an email recently from a heart surgeon. I did a video on TikTok about it where, he basically said, he used to get paid $5,000 or something like that for heart surgery. And, the facilities fees at a hospital might be $15,000. And now he's getting paid $3,000 for the same surgery, and hospitals are getting paid $75,000. And so,
Wow.
in 30 years of his practice, his reimbursement has gone down, but the cost of the service has gone up because they're layering in all these, hidden fees. And so we need to kind of shed light on that. We need to make physician care more accessible. If some of these surgeries can be done in an outpatient surgery center for a less fee, we need to make that an option for patients. If, I can have a private practice office and you can see me directly and text with me directly and have an appointment with me tomorrow, if you work directly with me versus going through one of these large behemoth private equity backed systems where they're essentially working, the physicians like factory workers and pumping patients through as quick as possible, and you're not getting good care, and I'm not getting, the ability to care for you well. We can make more streamlined, secure, and authentic connections possible with this technology.
So is your focus on doctors who are in private practice versus, because we've seen such a shift of physicians working for hospital systems now? They're 53% of physicians now work for hospital systems?
So 53% of physicians work for hospital systems, and United Healthcare, an insurance company, is actually the largest employer of doctors in the country. So, in my opinion, this is an antitrust problem. This is a right to work problem. If the insurance company is deciding how much I get paid for my service, what I'm allowed to buy and what not buy, but what am I allowed to recommend through prior authorizations with my patients, if they're deciding what medicines are going to be on the formularies and whether this imaging is going to be approved and paid for or not, and then they're also the one employing me, that's just a recipe for corruption and destruction of this system. And I'm very, very upset at our system for allowing this to happen because it's not reasonable. And so I believe that physicians should be independent. But if you think back to this heart surgeon that we talked about, he used to get paid $5,000, now he's getting paid $3,000. Hospitals are getting $75,000. They used to get $15,000. This is why physicians are becoming more and more employed, because in order for us to make a living, we have to work for these systems that are essentially fleecing the American public, in my opinion. And so, I want to get back to basics. I want us to have independent practices again. I want physicians, us, the doctors who took a Hippocratic oath to put you first, the ones who actually have the competency and the skills to make decisions about you. I want us to be able to work together to coordinate care with each other on par or better with these large systems. And I want us to unplug from the medical industrial complex that's essentially, commoditizing the pain and suffering of people. And that's what decentralized identity is about. It's about owning your right to work, owning your professional brand, being able to authenticate who you are professionally, digitally, privately, securely in a streamlined way so that we can get to work and not have to be plugged into these various systems that are essentially, siphoning money from our patients.
Now, Dr. Houston, we did some work several years ago with Dr. Tom Price, who is the Health and Human Services Secretary. And we developed something that was called Healthcare for You, which is really trying to address some of the issues that you were talking about. We had an opportunity to work with several doctors really that mentioned this issue and how the independent doctor is basically disappearing. I think at best now we're at about 25% of doctors out there are independent practice. The rest are employees, which is a really scary thought if you think about it, because exactly the way you laid that out. So how do we kind of reverse that? Because, this is really just bureaucratic bloat at its best. It's another government, right? Between education and healthcare and the government. I mean, it's like the third branch of government, pretty much. I mean, how do we take this back? I mean, I guess HPEC is part of the concept that's going to do that. Is that correct?
Yes, part of the reason it's hard to have an independent practice right now is because the large vertically integrated systems, the private equity-backed companies, and the insurance companies all essentially own the referral networks. If you are part of a large health system, they're going to try to keep you within their system and only funnel you to doctors within their system. If you have a certain insurance, they're going to control what you get and where you get to go. And if you go to a doctor who's employed by a private equity-backed company, that private equity-backed company, we know the private equity model. It's reduce costs and collect as much profit as possible,
Right.
which means that you get as little as possible in order to keep you as a happy customer. They call patients customers now. It's really, really awful.
Wow.
So if we can give each physician a digital identity, a decentralized identity that allows them to own their professional brand, allows them to own their credentials. I'm an emergency physician. I went to residency. That's a credential. I have my board certification in emergency medicine. That's a credential. My medical licenses. If there's a way for me to quickly and easily authenticate that about myself so that I can have a private practice and so that other physicians can find me and so that we can find each other, we can essentially optimize and personalize patient care in a way like it's never been done before. And because of these new rules, these No Surprises Acts, there's new FHIR protocols that are allowing access to authentic patient data. The 21st Century Cures Act is also putting out rules and regulations around access to this information. There's TEFCA standards. So they're starting to realize that we need to properly index this information. We need to make it accessible. We need to stop with this data silo stuff. And if we empower the physicians with a tool that allows them to streamline and automate their own data and their own information in a way that allows them to coordinate care amongst each other, then patients can find the right care and we can make sure to get patients the optimal care for them, regardless of their insurance company, regardless of their employer or which health system they saw last, because that data will now be immediately accessible.
So, Dr. Houston, am I simplifying it too much by saying that it's basically what you've come up with or are coming up with is basically a patient-centric referral network?
Yes, absolutely. If you think about it, the day you're born, the doctor signs the birth certificate. The day you die, we sign the death certificate. So from cradle to grave, we are creating the data about you. And so now that the world is digitized, this data, you should be able to access and own your data as a patient. And because I create that data about you, that should be something that's transferred between you and I, not a third party, not a centralized system. And decentralized identity allows that to happen.
Hasn't HIPAA, though, kind of got in the way of all this? I mean, that's what I'm hearing, that HIPAA's been a big issue that's caused some of this stuff.
What's really interesting, HIPAA has nothing to do with me as a doctor. HIPAA has to do with centralized systems. HIPAA was created so that centralized systems would not be allowed to share your personal health information. But if you're my patient and I did an EKG in my office and you say, can you text me a picture of that? That's a consensual decision that you are making with me. And I can take a picture and text it to you with my phone if I want to. And so HIPAA doesn't apply between a doctor and a patient directly. It only applies when that EKG is uploaded to an electronic health record or when that EKG is being billed for by an insurance company. Then HIPAA is, invoked, where that centralized system now needs to protect and privatize your data. And that's what people are confused about. They think that we as doctors aren't allowed to share information with our patients. It's not true. It's the third-party centralized systems that aren't allowed to share data because of HIPAA, and that's creating that friction.
What about the regulations around Obamacare on electronic health records and the what you have to comply with there? Is there any issues there for your system for HPEC?
Well, what happened with electronic health records is essentially they made it initially optional, but then they created so many regulatory hurdles and fines, essentially, if you don't choose this optional system. That's another reason that physicians are becoming increasingly employed, because the administrative burden and the technical cost of maintaining these systems in a private practice is so high because the regulations keep changing, the hurdles keep getting higher and more frequent. And so, when you're an independent doctor and you have an independent practice, you can use EMRs. And now I believe with these new regulations, if they are in fact enforced in the way that they're written that they should be enforced, this should make it easier for independent practices to share information between EMRs. These APIs will be publicly available, yeah.
Not to be a conspiracy theorist, but isn't that the goal, to march us towards a single payer system, is to move all of these physicians and corral them under these big healthcare systems so that everybody's employed in this centralized system and we can just keep marching towards single payer? Isn't that really the goal there, is what they're trying to do?
I'm not going to speculate on why they're doing what they're doing, but I am going to say it all has to do with money and controlling the money. We talked about $4.2 trillion. Who controls the flow of that capital? The doctor. Without the stroke of our pen or keyboard nowadays, you don't get that surgery. You don't get that prescription. You don't get those labs ordered. So because we control what's ordered and what's paid for and what's covered under these plans, they have created these regulations to control us and to control our behavior. And so I don't know if it's to create a single payer system or if it's just to create a flow of capital in the direction of the people who are creating the policies, whoever they may be, whether it be corporate, corrupt corporations or crony government bureaucrats. I don't know. I think it's a combination of both personally, but that's why I think decentralizing the system and putting the power into the hands of the individual is the answer, because the centralization is the problem. Whether it's centralization of the power in the government hands in a single payer system or centralization of power in corporate systems like, insurance companies who now employ the majority of the doctors in the country.
Right. What about we worked a lot. Alfredo mentioned our Healthcare for You, which was a policy framework for healthcare reform, but it addressed some of the issues surrounding the electronic healthcare records and moving bureaucrats out of the exam room, and so the decisions are made between doctors and patients. I mean, everything you're saying is music to our ears on the policy side, and after working with so many of these direct primary care physicians on the policy side, so they're fun to work with because they understand the patient perspective and what the patient needs. They're also small business people and they're trying to run a small business. And I actually have a direct primary care physician for myself personally, for my primary
May I ask who
health.
It is?
Dr. Chris Ogan in Orlando, Florida.
Awesome. I love it.
She is wonderful, but I have access to her almost anytime I want. She prefers not at 2:00 in the morning, but I can text her with a quick question, or I can text her and set up an appointment. It's been a phenomenal system, and I talk about it to everybody I can, and I talk about the reasons why I moved into a direct primary care situation and how my traditional healthcare system failed me as a patient. And so I talk about that a lot. Are those the types of physicians that your system would attract first? And then you can move towards trying to draw some of those employed physicians out of their situation with the big hospital systems.
So HPEC is a physician-owned company. We have physician investors. We've raised $1.1 million from doctors in small crowdfund, anywhere from a couple $100 to $25,000. And our largest investors, the three top investors who have invested over $20,000, are direct primary care doctors, because they understand that, in order to really scale direct primary care, direct physician care, even direct specialty care, we need to have a way to coordinate care amongst each other. Now, direct primary care doctors are very independent thinkers, and there's many of them who just hate the idea of even plugging into these new government, APIs that give you access to data. But the fact of the matter is it's an opportunity. Right. It's an opportunity to untether the patient community at scale from these centralized systems and coordinate care amongst independent doctors. And so the people who really take some time to understand this, understand that. And, I'm connected to some of the leaders of the direct primary care movement. Dr. Kim Korba is another investor who worked on policy in Washington on this. And
we've worked with Dr. Korba.
Yeah. So, yep. We have some of the most activated and involved physician advocates out there in this company, because they know it's the future.
Now, I know that later this month, I think you're going through another round, I guess, or currently another round of financing. I think it's the end of this month, roughly, when you're looking to close that up. Game it out for us. Like, what is the plan here? What's your kind of rollout vision as you go through these different points of your plan?
Patients should own their data, and doctors should also own their data. Right now, we don't. Right now, we have to sign away all of our rights to our credentials if we are employed. When we are in private practice, there's no way for every doctor in the country to know where we are and who we are without going through a centralized system. So, the goal of this company is to give every single physician a decentralized identity, give them an ability to hold, store, and keep all of their permanent verifiable credentials in their digital identity wallet. So the day I graduate from medical school, I get my medical degree digitally. It's mine. I own it. I control it. It's in a secure, encrypted cloud wallet that only I control. And within this system, we have an ability to search for each other, to search by state, by specialty, and to connect with each other and securely message each other and coordinate care. We want to build a referral machine for independent physicians with decentralized identity. And we want this to also be a tool for physicians who want to be employed to be able to authenticate their credentials, get to work quickly and easily, and also, importantly, leave jobs easily if those places are not serving them and their patients, and easily find work elsewhere. Right now, because many people don't realize the day that I'm hired as a doctor to the day I can actually start working is a 4 to 6 month process of authenticating my credentials. Wow. With decentralized identity, that can be instantaneous. It can be automated. So if I'm working for a system that in their contract they said I'd be seeing 10 patients a day, and all of a sudden I'm seeing 30 a day, I can quit tomorrow for breach of contract and find another job tomorrow. So this tool gives even employed doctors leverage. So it's a tool for the independents and the employed. It's a tool for, empowering the independent physician and giving them the tools they need to coordinate care for their patients without having to be plugged into those systems.
It sounds like you're well underway to become an industry disruptor. I'm sure you're on the most wanted list here of the medical community, or I should say of the large big healthcare providers, because I'm sure they don't want this disrupted the way you have vision to disrupt it.
Many people have asked me, do you have a bulletproof vest? Do you have private security?
They're probably not kidding, by the way.
I know. I mean, this 4.2 trillion isn't a small number. United Health made, I think, $450 billion last year alone. Right. But this is important. I spent my youth with my nose in a book learning how to prevent death and permanent disability. And then I entered a system as a practicing doctor that didn't allow me to do that ethically. And most physicians are experiencing the moral injury of the conflict of interest between what they know their patients need and what either their employers or their insurance companies are pressuring them to not give their patients.
So I know that right now you're looking at investors that are basically the doctor community. How do small business people or folks like ourselves, let's say, who say, wow, this is a great idea, you're onto something here. How do we get to invest, or at what point would we be able to invest in HPEC?
Anyone can invest today. We made a very unique opportunity available on Start Engine. Anyone can invest as little as $500. And there's special perks for people who invest more. So if you are a small business owner or a patient advocate who cares about this issue, who wants the future of healthcare to be physician-led, who wants to find ways to streamline, automate processes and decrease costs and make transparent prices available, come join us. Join as an investor. Go to Start Engine. You can go to my website, hpec.io, and click Invest Now. It'll bring you to Start Engine. We have exactly 24 days left as of the recording of this. So I don't know when it's produced. We might only have a week left. And we have a lot of really, really exciting things in the pipeline. For example, cross-state licensure, creating interstate medical licensing reciprocity. And so there's a lot of things that we want to do as a company, but it requires capital to build these technical tools and to deliver them to the practicing doctors who are actually the ones caring for you is our goal. So
let's do that website one more time.
HPEC.io.
.io. Okay.
And you can also find us on social media at HPEC ID. I put videos out about what we're doing and how we're doing it. And I'd love for you to follow us and share and spread the word. This is a grassroots movement. If we want to, have a change, we need to be the change.
We'll definitely try to get this out as soon as we can, Doctor, because I think it's a great idea. I think you really are onto something. I actually found you on LinkedIn. I think we connected through Kim Korba. So I'm excited that we're able to get you on the show and excited to get this information out to our small business community.
Awesome. And I participated in your Plug Fest around this. So, it was a really, really exciting opportunity for us. IBM is using this technology. Chase Bank is using this technology. Microsoft is using this technology. It is coming with or without us. So let's build it, to serve the patients and to serve the doctors that care for them.
That's wonderful.
Great. Well, Dr. Houston, thank you very much for joining Main Street Matters, America's Small Business Megaphone. I'd love to have you back in the future to talk about your progress and everything you're doing at HPEC.
Awesome. I would love to be back on. Thank you so much for having me on.
Thank you, Doctor.
And for those of you listening, please subscribe to the show at salempodcastnetwork.com or wherever you get your podcast from.